Okay. So again, thanks for having me here today. Wanted to just address the big elephant in the room. I know everybody, the announcements yesterday that the governor rescinded state guidelines regarding occupancy, closing times, and gathering sizes. Um, Local jurisdictions can still implement stricter guidelines, and currently there is a Board of Health uh, order in place that went into effect on November 20th. So next week, we are planning a special Board of Health to relook at those and discuss because of rules with having to do public notification, things of that nature. It just wasn't able to happen any sooner than next week, and with Monday being a holiday. So I apologize it's not sooner. We welcome feedback and comments at that. It will be open to the public, um, and really do want to hear from everybody within our community. So I can say I've I'm hopeful with the direction that we are currently going in. The last couple of weeks, we've seen lower numbers than we were experiencing in November and even December. And that's a very encouraging thing, especially when placed alongside of the vaccine rollout. So, and I'll be talking a little bit more about that later. Um, so I guess just to start with, same thing. You guys are probably all very, very familiar with these at this point, but symptoms to consider when we're looking at this, and particularly because we are in flu season, although we have not seen any confirmed influenza here. Um, the symptoms are very similar. So your cough, your shortness of breath, fatigue. Something unique to COVID is that loss of taste or smell. And a lot of people also experience in that congestion, sore throat, nausea, and vomiting or diarrhea. The way I've always looked at it is if you have kind of one of the big four, that cough, shortness of breath, new loss of taste and smell, or fever, that should really prompt a visit to see the doctor. If you have two of the other ones, that should prompt a visit to go get tested as well. So then I know that recently guidelines changed fairly recently regarding quarantine. Isolation did not change. Isolation is still for those individuals that tested positive for COVID-19. That still means those people should be staying home, separate space from household members. You'll notice I have my nice closet behind me today because I'm at home in quarantine. Separated from my children because one of them is positive right now. So it is possible to do it. It's not going to work or having other outside activities outside of the home. Release from that isolation can happen as soon as 10 days after symptom onset. There has to be that minimum of 10 days from either symptom onset, or if somebody never develops symptoms, 10 days from the test date. They also have to be fever-free for 24 hours without the aid of fever-reducing medication and have an improvement of symptoms. Once in a while, we'll run across something where someone has really severe disease or a very severe underlying condition that compromises their immune system. Their isolation may be extended up to 20 days. Just because they can stay infectious a little bit longer if they don't have that immune system to fight it off, or they've had a very severe disease with it. What has changed in regards to guidelines is quarantine for individuals. So individuals that are placed into quarantine, there's now some options for them to get released from quarantine a little bit earlier. As we've learned more and more about this disease and infectious periods, everything else, and looking kind of weighing risk and benefit, it's really been determined that right around that 10-day mark for people that have been exposed, if they've been asymptomatic the entire duration of those 10 days, it is very, very unlikely that they will pass that disease on to somebody else or develop symptoms at that point. So the recommendation still is 14 days from symptom onset to monitor yourself, look at your, taking fever, monitoring for symptoms, everything else. But if you reach that 10 days, you've been asymptomatic the entirety of the 10 days, there's no test required, and you can return back to activities as normal. There is another option to test at day 5 or later. And if you are still asymptomatic, get a negative test result from that test, either from day 5 or later, that you can be released from quarantine at after day 7 of quarantine. So it does confuse things a little bit. However, I've seen a higher level of compliance from people. It does make it a little bit easier on businesses. 7 days is a lot more palatable than 14. That does put out workforce for less time. And I hope that that's helping in some of the business realms, being able to keep staffing levels at where they need to be. Questions about that? I see there's a couple that may have popped up.
Hi, Trisha. Sorry, we got a question from Whitney Olson. Just how do you calculate the last exposure from someone in a house with COVID, with a COVID positive person? So you got a household member, they are tested positive. What is that last day of exposure?
So it really depends. If you're able to fully separate within your household, the last day of exposure when you would have been around that person, and I'll have that slide up in a minute, that you would be considered a close contact, have that more than 15 minutes within that 6 feet range for over a 24-hour period. So for instance, I guess as an example, here within my household, we all went into quarantine at the same time. My daughter then had a positive test and developed symptoms a day later. So we counted that first day, we probably still passed each other enough, we're around each other enough that we didn't, I considered that an exposure day. Once we got those symptoms and she was starting to exhibit anything, we have separated out in rooms, entirely different bathrooms, cleaning in between usage in the kitchen, anything of that nature. So my last day of exposure would have been the day before we got that positive test result and symptomatic. Where it comes up a lot, and we've dealt with this in schools in particular, is with children, young children in particular. It's really difficult to isolate from them in many instances. And in that case, you would go by the last time, again, either that 10 or 7 days after the person that is in isolation is recovered. So it does extend that oftentimes for small children. But otherwise, that's, I'm going through a similar situation with a family member with that, and they're extending it out, going to get their child tested day 5 and move on from there. I hope that answered the question, Whitney.
Trish, can you hear me?
I sure can.
Okay, so the situation is I don't think that they did separate. And so the letter came from you guys in the mail, and it was we sent them home on a Friday. The letter came and said, your days starts on Monday. What should I tell those people in those instances where, okay, you've come to me, you have somebody at home that's positive. Do I tell you, option A is you go home and you stay away from somebody and you get to come back to work in 10 days if you're still feeling all right? Or you go home and you hang out with these people, then your 10 days starts at what day?
The
I
last
want to
day.
be able to make the claim to them, hey, if you stay by yourself, you get to come back to work a lot sooner.
Yes, and I think that's the appropriate answer, Whitney. So if they're around them and continue to be around that person, so say a spouse or somebody else, they would need to start that 10 days at the end of the positive person's 10 days if they're hanging out with them the entire time.
Okay, great. Thank you.
Yep. Then just general guidelines for employees. I think we touched on this a little bit, you know, those big ones, if they're exhibiting fever, cough, shortness of breath, or new loss of taste and smell, they should be excluded from work and get tested. If they're experiencing 2 or more of those other symptoms, kind of a general rule of thumb, same thing. I would ask them to get tested. The tests are very, very reliable and accurate for symptomatic individuals. So if someone is symptomatic, gets tested, it comes back negative, they can return to work once their symptoms have resolved. Or say it's, you know, a small runny nose or something like that. We are seeing that, particularly with the implementation of mask usage, that's helping reduce some of the transmission of these other things like common colds. And we believe that's also why we aren't seeing nearly as much influenza right now. If they do test positive, of course, you go to the 10 days from symptom onset or test date if they were asymptomatic. And while they're awaiting those tests, we do recommend that they stay out of work. I will say we are very fortunate here in Great Falls we have that drive-through testing available. They are also doing the testing in-house locally now. So we're seeing results and turnaround times of 24 hours in most cases to get those results back. And that's a really wonderful thing for our community that we have in place. We also touched on this a little bit, who a contact is. So close contact is someone you've been with in that 6 feet for more than 15 minutes, cumulative over the 24 hours. And it goes back to the 48 hours prior to symptom onset for that positive person, or 48 hours prior to their test date if they were asymptomatic. So if there is someone that's not identified, a family member or a friend, say the family member was out of town when the person, their spouse or child, tested positive, they weren't around them the 48 hours prior, they wouldn't be considered a contact unless they came home and had contact once they were home. So in those cases, they would not need to quarantine. There's also some sorry, the train just derailed. Recommendations just for, you know, looking at things like work, everything else. If you're keeping your 6 foot distance at work, wearing those masks, doing all of that, you're very unlikely to be named as a close contact in those situations. So that's one of the real great reasons to implement that social distancing within your workplaces. Yeah, which brings me to the next one, those general guidelines that businesses can use. If you can maintain that 6 feet between yourself and your coworkers as much as possible, that's going to eliminate any contact tracing within your business. Where available, telework should still be utilized. And then you can do things like stagger your breaks. So not everybody takes lunch at the same time sitting around the same table, or goes and has coffee together for 15 minutes. Those are the kind of things that we've seen that have hurt some workplaces at times. So we really encourage you, if people are in the break room at the same time, that they're making sure to keep that distance between them. Masks also should be used by all employees anytime they can't maintain that 6 foot distance. So when you're in your individual office, I think it's perfectly acceptable to have your mask off. I know the policy we implemented in our building was when you get up out of your chair to leave your space, that mask goes on as you are in any of the other public areas in our building. Still recommended to kind of do a symptom screening on a daily basis. That can include temperature checks and just symptom checks. We have a particular person that we all report to every morning, takes our temperature, asks if we have those. I've seen a number of places that just have a sheet that they have somebody check off attesting to the fact that they are symptom-free, don't have any of that going on. And then, of course, the last piece of that is making sure to clean any of, particularly those common surfaces, at least every 4 hours. More if you have a very large volume of people coming through. So a lot of the large stores, things of that nature, are doing more continuous, almost hourly cleaning on things, you know, shopping carts, every use, things of that nature. Those things are still the gold standard for prevention when we're looking at kind of help mitigate the spread of this. So that's what I've got for that. Before I start into the vaccine rollout, are there questions about the new quarantine guidelines or anything else that I've already covered?
So there was a question in the chat box again from someone as well. How would you assess close contacts of someone who is asymptomatic but tests positive? For example, if someone last had contact 4 days ago, but the person tests positive on day 5. So they've been asymptomatic.
Yeah, so in those cases, if somebody's totally asymptomatic but tests positive, you go back 48 hours from the test date. So if they were last in contact with them 4 days prior to their test date, they would not be considered a close contact. If they were in touch with them for that 15-minute 6-foot within the past 2 days, they would be considered a close contact. So yeah, you go back that 48 hours prior, either symptom onset or if no symptoms, test date.
Okay. Thank you.
So you're welcome.
Any other questions? And if you have a question too, you can raise your hand. You can send it via the chat box, but no, thank you.
So then I know the big thing that everybody's talking about and anxious about and hearing about right now is vaccine rollout. Vaccine rollout, they did just change the state of Montana, the phases slightly last week. Phase 1A stayed the same. That was for your frontline healthcare workers, long-term and assisted living facilities, those healthcare workers with direct patient contact. And we are currently in the process this week of the different agencies that have signed on to be administering this vaccine, finishing out this group of individuals. So we are still working on catching a couple of those stragglers and finishing out this group. Next week, we're set to receive probably middle of the week vaccine and get going on phase 1B. And I'll talk more about that in a minute, right now, in fact. So this is what has changed recently. Phase 1B, basically the, excuse me, the phase 1B and phase 1C kind of flip-flopped last week with the governor's new recommendations. So phase 1B now includes people age 70 or older. That is the category of individuals that are seeing the highest mortality and morbidity in relationship to this particular illness. The other ones that have been included are American Indians or other people of color who have those underlying conditions that put them at higher risk for COVID-19 complications. And then other individuals between the ages of 16 and 69 with high risk medical conditions that are listed down below. So you're looking at somebody that's gotten an organ transplant, they have chronic kidney disease, they're currently dealing with cancer or COPD, have heart conditions such as heart failure. And then of course they do allow for that provision if your medical provider is saying, no, you really are at a very increased risk for this disease, you would fall into that phase 1B. We are currently working on finalizing that plan for the rollout here in Cascade County, and there will be something in the news bright and early Monday morning about a sign-up process and where it's all going to be happening. We will be doing some mass clinics and have online portals for people to sign up, and those will go live next week. We're just putting the finishing touches on all of them to get that in place. And yeah, hopefully we'll be able to get this community really started and those people protected, and that's going to ultimately end up leading to, you know, restrictions lifting in many respects. So I know I personally am very excited for that. So phase 1B is set to start, you know, mid next week and last about 2 months. Then we'll be rolling into phase 1C. This is what phase 1B used to be. So this encompasses all of those frontline essential workers, anybody age 60 or older, individuals that live or reside or work in congregate or correctional facilities, and still includes that group of people with underlying conditions, ages 16 to 59. So, but broadens the conditions that are included in there. So has things like hypertension or high blood pressure, asthma, things we see a lot more commonly, but maybe don't provide or don't have quite as high of a risk as some of the other conditions. And yeah, that's set to go live hopefully about mid-March, again lasting about 2 months, and then after that we move into the phase 2, which is opening it up to general public. So we're really looking at, you know, over the next 4 or 5 months before our community is fully covered with this vaccine. So like I said, one of those things is we are working really hard. I've been on meetings all morning to try to finalize this plan for 1B rollout. We really appreciate everybody's patience with it. I know it's been very difficult for people throughout all of this, and you hear one community doing this and one community doing that. We won't receive our allotment of vaccine till probably midweek next week. So, you know, maybe end of week or beginning of the following week is when you really can expect those clinics to start happening to address it. I really encourage everyone to visit the state website. They have lots of great information on there about the vaccine, the rollout, the phases, and their plan from the state level. So that's a great resource to use. There's other things we didn't touch on yet, and I didn't make a slide for, so I'll just talk about when I'm talking about the vaccine. So this is under an emergency use authorization. It's what that means is the FDA has said, yes, we see the value in this vaccine. We have studied all of the studies that the companies have done and believe that it is safe, effective, and we're moving forward. It is only licensed for individuals age 16 and up for the Pfizer vaccine, age 18 and up for the Moderna vaccine. So there's a couple small differences there. The other things that come into play with those two different vaccines, Pfizer is the one that has to be stored at ultra cold temperatures. Moderna can be stored at a higher temperature. Pfizer has a 3-week period in between, so 21 days between the first shot and the second shot. Moderna has a 28-day period in between the first shot and the second shot. They are currently doing studies on children to see the efficacy and safety in children for both vaccines. But that's why it's not yet authorized for use in that population at this time. So with that, that's what I've got for you. I would love to hear your questions.
Trisha, I have a question. For the vaccines, is Cascade County getting both vaccines, and how are you, like, is it just random which one you get, or do you have a preference, or how does that kind of work?
Yeah, so we will be receiving, what we've been told is to expect kind of even distribution between the two. Part of that is we have locally here Benefice and Great Falls Clinic who have that ultra cold storage temperature availability. So many smaller clinics and rural communities don't have that availability to that equipment to be able to store that vaccine. So we will definitely be receiving both vaccines. When we're looking at our plan, it will be random which one you receive. We'll have certain days that, you know, as we roll it out, we're only doing Moderna or only doing Pfizer. The safety on both of them, the efficacy on both of them are very comparable. So reactions that people have seen, side effects, all of that, they're quite comparable. The biggest difference is the storage handling and that time period in between first and second doses.
Trisha, this is Angel Tarosky at Great Falls Central.
Hi, Angel.
Hi. I'm wondering, can we, if I have staff that fall into, part of them are going to fall into 1B and part of them are going to fall into 1C. If I have staff that I know have anaphylactic reactions, and there's one of those that has a bigger kind of problem with one or the other, is that something we would contact the health department about to let you know I've got someone in that 1B that wants the vaccine, but I don't know if that's an employer situation or if I tell the employee to contact their doctor. I just don't understand the process for us as employers.
So as an employer, you wouldn't necessarily, I think this is not, I'm not aware of any employers yet that are requiring this vaccine. So it is still up to the individual. If there's somebody that has had severe anaphylactic reactions in the past or allergic reactions, I do recommend they talk to their doctor. Any clinics that any place is holding, however, we do have and will have emergency staff on site to address that. We are still keeping people for that 15 minutes after for observation. If we're aware that they've had previous reactions, we'll keep them a half hour afterwards to observe them to make sure that they continue to be okay. But I would recommend they reach out to their doctor to discuss their personal situation and see what their doctor's advice is moving forward in terms of getting the vaccine.
As a school, would it be smart for me to work closely with the health department, or because we're a small school, should I just have everyone contact and do their own thing? We are encouraging the vaccine because of course we're coming in contact with lots of kids.
Yeah, and I think you are a great example of a place that like you very firmly follow, all of your staff does, into 1C. I think probably most everybody on this call does. And I do encourage everybody to do that. With the information that will be coming out early next week, there will be a method to sign up, and that's probably what we're going to be employing moving forward for people to individually set up their own appointments.
Thank you. I
You're
appreciate it.
welcome.
Great question. Any other questions? Any other questions from anyone else for Trisha?
Well, there was a question in the chat. Is the vaccine free to everybody?
It is.
Okay, so you just come in, you just come in and I want the vaccine if you're in those groups?
Yep. So we will be doing it by appointment to try to avoid. It's nice in a way that we didn't receive some of this as soon as some other places, because we've gotten to watch what didn't work in other places, such as having multitudes of individuals waiting outside trying to get in and then being turned away because the vaccine ran out for the day, or things of that nature. So we're trying to do it very conscientiously to avoid some of those. It will be by appointment, and you won't need to bring any kind of insurance, probably identification of some sort, and it will be free to everybody. This is something that we're receiving the vaccine for free. We can technically bill for administration fees. We're just to be able to kind of help recoup some of the costs associated with staffing and things of that nature. But with these mass clinics, no, we won't be.
And then also in the chat, if there is a very compromised spouse and in B1, can the spouse also get the vaccine at the same time, even if they are not themselves compromised?
The way the guidelines are written right now, no. That is something I just posed to the state because I've been posed with that question a couple of times. And they are looking at that as a possibility to add into.
And then one more coming through on the chat. You guys are doing great. How soon can you get the vaccine after you have had COVID?
You can get it the day after you're considered recovered. So if you are in quarantine or isolation, as soon as you are out of quarantine or isolation, you can receive that vaccine. You do have, all of the evidence shows that at least for 90 days, we have that natural immunity. So people can choose to wait some of that 90 days to get it, but they do not have to wait. The one place where they would have to wait is if they receive the monoclonal antibody infusion, which is a treatment that's given to people that are infected, and it helps relieve a lot of the symptoms. We're seeing really good results with that treatment. In those individuals, they do need to wait the 90 days before they get the shot. So that's about the only category where it does kind of firmly fall out of that. The other exceptions are if you've received another vaccine in the previous 14 days, they don't recommend getting this one at the same time. I'm trying to think. I know there's one more and it's not coming to me. Oh, if you're pregnant or breastfeeding, they do recommend consulting with your doctor right now, just because there haven't been specific studies done to look at pregnancy and this vaccine in particular.
Okay.
Great questions. Those are really good questions. Trish, I know there's been obviously this hybrid, I'll just call it a hybrid COVID now, that seems to be more infectious. And I know you touched on the flu season, and thankfully again, that we haven't had a confirmed influenza case in Cascade County, but can you just maybe share a little bit about that? What are they seeing? You know, I know they're saying it's more contagious and things like that. Can you just touch on that a little bit? And again, getting the information from you just helps us also educate and inform others as well. So.
Sure. Yeah, so that new strain that you're kind of seeing come out and that people are talking about, that it's mutated, viruses very commonly mutate. That's something that has been accounted for with the vaccine. And they are seeing, of course, they're studying it very carefully right now to make sure that those vaccines are still effective against the new strain. And all preliminary studies that are coming out are showing that, it does appear to be quite effective against that. the new strain or the mutated strain, really what it is, it appears to be even more easily transmitted from person to person. So I think it was put to me, and an easy way to think about it is, with the COVID we've been dealing with for the last year, if you were infected and you were around a large group of people, you could expect up to about 10 people to become infected. With this new strain, you could probably expect up to about 15 to become infected. So it is more transmissible. However, it doesn't appear to be causing any more severe disease in people. So the symptoms aren't any worse for those that are encountering this new strain.
So just to recap, just summarize real quick. So this new strain is about 50% more contagious or infectious. You kind of use the 10, it might infect, now it might be 15, you said, 1.5?
Yeah, and those are kind of rough estimates. They're absolutely still studying that to see exactly how much more contagious it is. You know, preliminary things said, well, maybe up to 70 more percent more contagious. Some as low as 50, some are even lower. So it's still, that's not an absolute final number by any means, but because they're still studying it, it's still new, and we're still learning about what that particular strain is. But in general, yes, that's kind of a good way to look at it.
Okay. Then to recap your other comment, if you get the vaccine, it should protect you, you said, from the various strains that they determine will probably develop from the initial ones. So,
Correct.
okay.
And that's very similar when you think of, so every year when they do the influenza vaccine, they have a predictive model that they look at to determine what strains of influenza we might see each year, and they address those in that. It's built into the technology that we're using to address mutations, because we know that those, particularly some of these respiratory diseases, do mutate fairly regularly.
Okay. What are you looking at kind of down the road a little bit with COVID and maybe 2 years from now, possibly?
You know, I think this is going to be something that we have endemic to society. It's going to be around. I don't think we'll ever see COVID go away. As you indicated, coronaviruses, that's the common cold, is a coronavirus. There's multitudes of different strains of it, and we've had that around for years. I see it more going in the direction of something like that eventually, or address such as like your annual influenza, something that's probably going to be recommended for a vaccine on a regular basis. Again, still being studied. They don't know exactly how long yet this vaccine is effective for. So that's still being studied. And of course, that just takes time to know. But I do see it being something that is here, but not nearly to the level that we're having it now, since it's a novel new virus.
And one of the questions that came through, and it might just kind of go right on this next, what kind of we were talking about, this here to stay, might be a shot you might need to take, but how long will the vaccine last? And do they assume that it would be an annual vaccine or a semi-annual vaccine? It's one of the questions.
And that's still under study. They don't have a definitive answer for that. There is encouraging news just showing that natural immunity, there's a very good chance that we're going to see that 90 days extended out for just natural immunity, which also speaks to the probability that vaccines will last quite a bit longer as well. But as of right now, that's still an unknown. We just need the time to watch and see.
And then is manufacturing considered essential workers? I mean, I'm always working on something, so I could be called a manufacturer, but we're talking about people that really build things that we can put our hands on.
I believe so.
Okay. So I guess one question I have too, you guys, and I know the first call was just contact tracing. Of course, that's when we were really seeing the spikes in our county. you know, the challenges with that. And of course, I work with Tom closely, him as well. And I know he's on your board as well too, but I'm sure you guys are caught up now. You feel comfortable with the tracing contacts, and there's no delay in that now, is there?
There is not, thankfully. We've, and I think that's a kudos to the community, and that tells me that, you know, people really are doing everything they can to try to mitigate the spread of this. We're seeing our rates go down, particularly since the last time that we spoke. And we don't have hundreds of cases coming in every day. We also we hired some more staff internally. We're at the point where we're able to respond to each case very quickly now, and get those addressed. So there isn't that backlog anymore.
Okay. All right. Any other questions from anyone else? Kind of give you one last go on it. Well, Trisha, again, thank you. You're the hardest working person in Cascade County, I know for sure, for the last 9-10 months. And we just appreciate all your efforts. And we definitely know you're trying to balance the needs of number one, health needs of the community, along with all the other needs that we have. And so you've done a great job balancing it. We appreciate it, understand, you know, what you're going through as well too. So, but we just appreciate you again. We know you're busy taking the time to visit with us, with our chamber members, with other folks that were able to join us as well too, and just share with us an update and the information as well. So everyone, thanks for joining us. We are going to, again, as soon as we find out, we will also send out the information as far as when the meeting is. Again, we're looking at next Wednesday, so that will probably be Wednesday the 20th, and anticipating sometime in the morning. Trisha just needs to connect with her other board members to make sure that they can all make it as well too. Trisha, if you don't mind, maybe could you just share with us again the names of the board members, or if you don't want to, I understand that as well too, and I'm not trying to put you on the
Nope, that's public information, Shane. It's Tom Moore, Matt Martin, Amanda Ball, Terry Barber, Owen Robinson, Jane Weber, Dr. Geyer, Ray Geyer.
Okay, yeah, you bet. You bet. So, no, thank you. And again, I've reached out to, you know, several of them along with you, and you've always been copied on my emails, Trish, as well too. So, but we just appreciate you and what you're doing, and your ability to, how do I want to say this? I know you're like a duck. You're calm on the surface, but you're paddling like crazy underneath. And again, we just appreciate that and what all you're doing. So again, thank you. Thanks everyone for joining us. Again, Trisha has her information on there. If you need to give them a call or send them an email, they're available, and they're here to help us and our community get through this, you know, as well as we can, as strong as we can. And, you know, there will be an end to it at some point. It's with us, but we just want to finish strong. And again, thank you for all of your efforts as well too. So we have recorded it. We will send out the slide deck when we get it. And again, thanks for joining us, everybody.